Today let's talk about how we can support veterans in primary care. In the United Kingdom, a veteran is defined as anyone who has served for at least one day in the British Armed Forces. The Armed Forces Covenant encourages GPs to identify veterans in their medical records, and also by asking patients whether they have served in the UK Armed Forces helps facilitate better care, putting this information down in referrals, but also providing further support and care that veterans are entitled to, which we'll talk about in a bit. The code to use when running a search is military veteran. Now there might be many subcodes, such as Army, Royal Navy, RAF, Royal Marine Veteran, but these should be hopefully covered under the single term military veteran. This will help easily identify veterans when running searches, especially if this is included in their problems list. We're now going to be talking about a few specific services that supports veterans, whether it's for their physical health or their mental health and well-being. Now, it's quite easy to remember as most of these services start with the word OP. And it will also be very useful to have a military service number to hand to facilitate referrals, but when you have a chance, please have a look at the referral forms when you have some time. Now we'll start with the first service, OP Courage. Now veterans can access mental health and wellbeing support through this service. Now patients can either self-refer or the GP can support with this too, if required. I strongly recommend heading to the RCGP Veterans Health Hub website. It's got a very good e-learning module to help support and understand physical issues and complications that veterans may encounter either during or after their service in the armed forces. One of the ways GPs can support veterans to help with their physical health is through referrals to Op Restore. Now, unlike Op Courage, this is a referral that GPs themselves need to complete and refer onwards, and as mentioned, having a military service number to hand will help facilitate the referral. Perhaps after you've had a look at some of the resources shared, have a think about this simulated case where we have a patient who's been booked in to see to the GP due to concerns of ringing in their ears. Think about how you would approach this case normally with your daily practice, but also, would you change anything if you knew that this patient had served in the armed forces? Thank you for listening, and please share your learning with your colleagues. If you encounter a patient who has served in the armed forces, try and create a care plan for these patients. Take a moment to think about whether a referral to an ops service may help them, and signpost them to veteran charities that can also support them too. Coding them as military veterans in the problems list will be very useful, not only for your colleagues but also highlight the importance of reviewing previous care plans and if there's been any changes since they've last seen the GP. Have a discussion with your GP leads if they may be interested in becoming an accredited veteran-friendly practice also. As discussed, here are those references that I've mentioned for further reading. Thank you for listening, and I'll see you next time.